Thank you.
I was. I probably was.
Good morning, Board St. Lucie. Good morning. We're here at the Treasure Coast Advocate for Seniors. We are live on YouTube. And I guess I used to spell that wrong all the time, but they corrected me, but I can still say it, YouTube, right? So anyway, excited to see everybody here this morning. And we're going to start off by talking a little bit about, us and how, it's a challenging time right now for our seniors, and we all know that. And so we are out doing tremendous things. Our group has been growing. You can check us out on the website, and we've got a lot of upgrades in there just recently in the last 30 days. People have either changed jobs or emails or phone numbers have changed, so we've gone in there and made those corrections. So get a chance to check out our sites here, our Facebook site, and also our website, treasurecoastadvocateforseniors.com. So with that, we're going to go around this morning. Again, I'm Tom Scott, President of Treasure Coast Advocate for Seniors. I'm also the radio observer. And we're going to go around the room and introduce everybody. Start with
Joe. Good morning, I'm Joey with Billy Home Care in the Nurse Training area. We serve from Palm Beach up to Vera, Joey, and Steven.
Good morning, Rosie with Ability Home Care as well. We also help with HHA certifications, and we accept Medicaid.
Good morning, Catherine Griffin. I'm one of the founders of Treasure Coast Advocates for Seniors, and I work for Clinical Home Care Medicare Agency.
Marty Green with Seniors Home Services. We provide remote care, remote therapeutic monitoring, remote physiological monitoring, and chronic care management for through doctors, chiropractors, senior communities, and again, Marty Green with Seniors Home Services.
Good morning, Louis Esmayat. I'm the urogynologist at Port St. Lucie, and I'll be talking to you about kind of what we do a little bit.
Good morning, Mary Scott. I'm Greg Scott Group at Keller Williams. I'm also a board member. Good morning, everyone. Sarah Rodriguez. I don't work anymore. I was retired, 80 years old last week. Born and raised Seattle, then New Jersey, and now Florida. Here I am.
Hi, I'm Donna Ironside. I'm a public sport physical therapist in the area, and I've been hooked up with Activa. This is my marketing to David, who's also a physical therapist. Anyway, we treat urinary incontinence, constipation, which is very prevalent. I'm sure we all have some experience with that in our lives. And it's just a very rewarding way to help people and prevent further problems from coming down the pike. So we are very happy.
Good morning, everybody. I'm David with Activa Home Healthcare. I'm a physical therapist. Thanks so much for the introduction, Rebecca. I'm also the home health liaison and marketer as well.
Good morning, everyone. Let me be one. I'm with Molly South. Oops. And we take as temporary patients and their families who are having medical treatment on the Treasure Coast, or actually any place other than treatment.
Morning, I'm George Huff, I'm an elder law attorney and a board member.
Good morning, my name is Sierra Cannon. I'm a regional sales director with Harbor Place at Port St. Lucie, so only in town for a little while, but it's a joy to meet all of you to be here today to learn more about the advocates of seniors in Port St. Lucie.
Pat Miles, sales director, Harbor Place at Port St. Lucie. We offer independent living and assisted living.
Hi, good morning, everybody. My name is Tom Grossbeck. I'm the owner of Achieve Senior Placement. We help seniors and their families find the right assisted living and independent living memory care options.
Good morning, Stacy Cooper with Radiant Recharge. We do IV infusions, vitamin shots, manual lymphatic drainage. We do phlebotomy both on-site and at the comfort of your own home. We do have the ionic foot detox bath to get rid of all the toxins in your body. And we're here to assist you guys any way we can.
Hi there, I'm Martha Freitas. I'm with HCA Florida Healthcare, St. Lucie Hospital, along with Fathers and Highlands.
Good morning, everyone. I am Lola Delaval, the Global Administrator of Services System in Facility. We are a small assistant in facility for St. Lucie nurse contractor. This is my photography and assistant staff.
Good morning, I'm Linda Humbert, along with my husband Roger Humbert. We're both realtors for Keller Williams in Port St. Lucie, serving the Treasure Coast. I also happen to be an RN with a background in senior living for the last 4 years. So, both independent living, memory care, assisted living, and Mr. Humbert has worked for 40 years as a realtor. So we're proud to be here, and we'll be completing our application for becoming official members.
I'm the other half. She's the better half. Roger Humbert with Keller Williams, 48 years in the real estate business.
Hi, Christy Rick with Elder Home Care Services, also a board member and also on business transport.
Everybody knows when. Usually on a uniform, but our senior awards on veterans with aluminum, benefit of aid and attendance.
Nicole Bond with Harbor Place in Port St. Lucie, and also board member and secretary.
Good morning, my name is Alex Foreman with Techie Expert Web Design and More. As the name implies, yes, I do web design, but I do so much more. If you need anything from graphic design, email and backend automation, your Google business profile, basically any of your tech needs that help improve your online presence, I can help you do that. I also work with my mom to do live scan fingerprinting. We have an office conveniently located at 555 South Colorado in downtown Stewart. If any of you have assisted living facilities such as you guys, we can definitely help you out with your ACA level 2 background check needs. Thank you.
Okay, so can you explain how this is going to work?
Absolutely. So I also do the live streaming for Treasure Coast Advocates for Seniors, and we are providing this presentation, both our introductions and what you see here in this room, as well as the presentation by our doctor, available live on YouTube. So any of you guys watching this live, you can comment, and I will see your comments live. If you happen to see this afterward, it's going to be recorded as well and available on Facebook, YouTube, and on the website.
Hey, thank you. Welcome everybody again. So our coffee sponsor, for those that really need coffee this morning, Ability Home Care.
Thank you. Good morning. I'm Joey again with Ability Home Care. Your nurse registry currently serving Palm Beach, Martin, St. Lucie, Indian River, and Okeechobee counties. And I know plenty of you have people who work in home care and private nursing, so I'll keep this short and sweet. What makes us different? We don't only provide care, we also help build the workforce. We operate one of the only home health day schools in the area, ensuring a safe flow of trained professionals to help serve the community. We also are bilingual in our office. Everyone in the office speaks English and either Spanish or Creole, which helps us reach a diverse range of clients. We've been in business for 16 years, and in that 16 years, we have caregivers that have been with us since the beginning, which speaks volumes to the culture we've built. We're a high volume Medicaid provider, and we've been that way for years, and I'm looking to expand our impact. So anybody who works in hospice, DME, home health, or any business that can benefit from partnering with a company that has connections with hundreds of quality caregivers, find us, me or Rosie. We'd love to set a meeting and see how we can support each other. Also, I'm a certified American Heart Association BLS teacher, so if you need CPR, first aid, any recertifications or new certifications, I'm your guy. I have some cards back there. Enjoy the breakfast. Thank you for your time.
Okay, so most of you know this, we call her the godmother of Treasure Coast Iowa Students. Right? Started this how many years ago?
Back in 2008.
2008, so that's only 17 years ago. Times 365, and that's a couple days. So anyway, without further ado, Catherine Griffin.
Good morning, everyone. Thanks for being here today. I'm going to read the mission statement of Treasure Coast Advocates for Seniors and give you a little bit of a history of how this all got started. The mission of Treasure Coast Advocates for Seniors is to provide healthcare and financial education, counseling, and assistance on the Treasure Coast. TCAS, as we call it, was started back in 2008 when Mona Gwen Huff, Kim Nelson, Gil White, Pam Springer, Kathy Blackman, and myself, Catherine Griffin, decided over coffee to help our seniors on the Treasure Coast. Nancy Hannon, Leslie, Lee Borellis, others joined the board shortly after, but since then, Mona and Gail have passed, and we honor them with carrying this torch of assisting our seniors. We are all volunteers. We all have full-time jobs. But our commitment is to help seniors in need. In the past, we've helped seniors with your air conditioning needs, appliances, carpet cleaning, pest control issues, and even pet supplies. Many appliances, I might add. If you know of a senior that needs assistance, please speak to one of our board members so we can assist. Our meetings are here every last Thursday of the month, except for November and December, and we're always looking for new members. You can join us on our website, tcadvocates.org. And thank you all for being here today.
All right, very quickly. So Catherine's talking about, what have we done? Well, recently, in the last few years, we've had, some tremendous growth in Treasure Coast Advocates Seniors. And again, as she says, you can go online and you can go in and join there. Seniors themselves, if they want to watch this because they didn't get up early, it's on live and they want to see it recording down the road, they can join there. It costs them $5 a year. 1 year, $5. And of course, you can get a corporate membership, whatever you want to do, individual, or nonprofit. There's a bunch of different ones that are on the site. What have we done lately? What have you done for me lately? So, recently we went into a house, and you probably heard this last meeting, but Mary and I went over and checked on, make sure there wasn't any Mercedes when we're asking for help right in the garage. And we go over, and so we go in, and disabled person, I won't get into that, a husband can't work, and it's an age thing, and, they're just trying to provide. And so I took and look at the refrigerator, and the refrigerator was working for 8 months. Not 8 days, 8 months. They had a freezer open, hot part, they had a little metal thing in there for things that were cold, and one layer at the bottom was some food. So they were doing that for 8 months. We immediately got them a refrigerator, we got that installed. People installed it, called me, it was loud, and the lady would call me crying. She couldn't believe that a group of people, volunteers like this, actually did all the above to help these folks. And that's just one of many, many, many things that we did over the last 12 months. Just giving one example. Although we check out and we make sure that these people have a meeting. We did go to a house, when I went to the house, check on it, and I said, wow, it looks like the house was just painted, what a nice house, and we noticed in the house, and we did this in the garage, and the lady wanted a new refrigerator for the garage. But she had a like refrigerator. So she laughed, we laughed, and we left. And for the people that are in need, just to add to this, there's an assistance form on our site. So you go fill it out. If you know somebody in need, they're in need, they can fill it out. If you've got anything later, give it to us. I can take and get that, and we'll be glad to look at a real possible situation. So, back to Kathy.
So I'm going to read a little bit about our speaker, Dr. Louis Espelat. Dr. Espelat is a caring physician. He obtained his medical degree from Universidad Ibero-Americana in the Dominican Republic, where he grew up and completed his obstetrics and gynecology residency at Temple University Hospital in Philadelphia. Subsequently completed an accredited urogynecology fellowship at Cleveland Clinic. He treats the patient, not the condition, and works with the patient as a team to improve their quality of life. He's left a bunch of brochures at the back, so you can pick up his business card and the brochures, and it lists all the different services he provides. There's many. So let's give Doctor a big welcome.
All right, thank you for the invitation and having me this morning. I look forward to kind of sharing with you guys what it is that we do and how we can help our female seniors. Okay. If we can get the slides up, it's a short presentation, and I'm going to really discuss about the common female pelvic floor disorders that we treat. I'm recently new to the area here in Port St. Lucie, coming down recently from a Philadelphia suburb. I'm gonna skip this slide here because it's kind of, I had a great introduction, thank you.
You're welcome.
But yeah, this is how I got here, basically. I'd like to start off by saying, kind of explaining what urogynecology is, because it's not one of the common subspecialties that people know about. It's not really urology, it's not really gynecology, it's not family medicine. It's a subspecialty that got boarded in 2013 to fill the need and the void that women basically that provide specific care for women that aren't really addressed with urology or OBGYN, okay? We focus on treating the female pelvic floor, and we can do so in a non-surgical manner, as well as provide surgery when it's indicated. My closest allies are urologists and gynecologists, and like I mentioned before, we kind of fall in the middle. The urologists primarily treat men, although they can treat women as well. They focus more on treating cancer or stones, or if you need some kidney surgery or diversion surgeries. OBGYNs, I think most of you know, they help women with different stages of their lives, reproduction, having babies, kind of regular, I'm going to say healthcare maintenance. They do surgeries as well, and we kind of fit in the middle. We are here to improve women's pelvic floor health and quality of life. We don't pretend to do this by ourselves. We rely on colleagues, and that is, we try to work as a network together, bringing together ourselves, the gynecologists, the urologists, colorectal surgeons, and pelvic floor physical therapists. These pictures, I don't have a laser tip to it.
Should be one on.
Anyways, the point of these diagrams and pictures is really to show how complex the female pelvic is. There's a lot of things that confluence there. And if you look at the cadaver model on the right, you'll see how much of the pelvic floor is made out of muscle. And it's supposed to be that way to allow to have babies and whatnot, but with age and wear and tear, you get the brunt of it, and it actually results in a lot of the conditions that we need to treat. What are the common conditions that we treat? Urinary incontinence, fecal incontinence, prolapse. These all can be result from childbirth and injury, recurrent urinary tract infections, as well as postmenopausal atrophic changes. This isn't exclusive. This is just the most common things that we see. Urinary incontinence can be, when you cough and sneeze and laugh and jump and exercise, you have an unexpected leak. Some patients have a sudden urge to go, and by the time that they get off the chair, the bladder starts coming out, the urine starts coming out. And then there are other ones that are less common, but also similarly traumatic. Fecal incontinence, as the name suggests, leakage of bowel content. And between those two indications, those are kind of a top 3 reason why our seniors end up in nursing homes. Okay, so treating that, those 2 indications provides a lot of freedom for patients to stay in their communities. Some of the symptoms that we see with childbirth-related pelvic floor injuries is this heaviness in the pelvis, muscle spasms, pain, and then the problems with urination and bowel movements. On the picture there, if women were to feel something and look in the mirror, that's a common finding that they see. On the left is what it should look like. On the right is a common finding. And what they see there is the cervix, the tip of the uterus, kind of protruding through the vaginal opening. I'm going to step in here because there's a hyperlink, and this is to kind of help show what a prolapse is, because a lot of patients don't understand the word and kind of what it means. This is kind of a busy slide, but really there's some simple things that I just wanted to bring up. The vaginal compartment, there's 3 vaginal compartments that we pay attention to that can prolapse independently or in combination. And so when you look in here, and we show, you don't have a laser, right, you said?
No.
Okay, so in here, it would be a way to identify, this is the bladder, this is the urethra where the urine comes out, this is the vagina, the uterus on top, and the rectum behind, okay? And if you can ignore all these letters here, but basically any of these structures, the bladder, the uterus, or the rectum can prolapse. And if you look at this one, this is somewhat of an advanced prolapse depiction here, where the uterus has gone from its normal position to a prolapse position, right? And patients just feel that as a significant actual bulge. And the same thing, like I said, can happen with the other compartments. The bladder can go from a kind of a horizontal plane to a vertical one and protrude out. Similarly, the posterior. And patients become very symptomatic as a result of this. It's not a life-threatening condition, but it is very bothersome and, can affect the quality of life pretty significantly. Yeah. Like I said before, surgery is not the only answer. There are non-surgical options that we can employ for a lot of the conditions that we see. Exercises, physical therapy, really working on that pelvic floor muscle complex to kind of help compensate the patient's symptoms. There are pessaries. Pessaries are vaginal devices. They occupy space within the vagina. And as long as it's in there, it kind of helps keep things in place, okay? And then there's medical treatments for the different conditions. Not necessarily as much for prolapse itself, but for some of the other conditions. When it's indicated and when it is desired, surgical treatments are always an option. Nowadays, we do these minimally invasively, which results in less pain for patients, quicker recoveries, and quicker return to normal life activities. Implants are not necessarily uncommon in order to address weakness issues. We kind of discussed this already, the advantages, less time in the hospital. Most of what we do nowadays is outpatient surgery, so the patients are able to sleep in their own homes the same day. Procedures that used to take hours and 3 to 4 days in the hospital have become outpatient procedures. Minimally invasive procedures have led to kind of less blood loss, and again, kind of quicker recoveries and less pain. One of the tools that we have in our toolbox that helps us kind of meet that is the robotic surgeries. We're able to do major surgeries through very small, tiny incisions, and that really is the key for the faster recovery, the less pain. And I have this slide here, just mesh has become a bad word in urogynecology, transvaginal mesh. I'm sure everybody remembers seeing on TV what mesh was and whatnot. But I am thankful that the FDA banned the sale of these meshes that were causing problems. They've made my life a lot easier. You can't get them anymore, basically. Okay, and so that's that. The bad word is we still have mesh in our toolbox, but they don't come with the long-term potential side effects and complications that we used to see. And then this is our office. We're conveniently located to here. We're at St. Lucie West. And we're happy to see patients that you think are in need. Okay? Thank you.
Questions, anybody? Any questions?
Does Medicare cover both surgery and the non-surgery part?
Yes. Medicare and commercial and all insurances, this is medical necessity. It's pretty straightforward. We don't really have to jump through a lot of hoops to get these done. Patients will be held to whatever their insurance contracts are, but this is pretty straightforward. Yes?
Two things. I was the recipient of a Da Vinci hysterectomy when they pulled my uterus out of my belly button. There was almost no recovery. I mean, it was beautiful. What a magnificent surgery. So I'm very delighted with the advent of that. Guys, it's great. And secondly, something that we all should know is that when a woman goes through menopause, what What estrogen will do is it supports the pelvic floor. So when that goes away, which will go naturally, you're gonna have a lot more weakness, and it's not your fault, okay? So 2 things that the doctor can prescribe something, estradiol.
Absolutely.
Yeah, so estrogen can be applied topically to the vagina, and it's so safe nowadays that even some patients with a history of breast cancer can utilize it. And secondly, pelvic floor exercises can be super helpful at this stage.
How do you perform your pelvic floor exercises?
Well, there's Kegels, but then there's other exercises that we would do. So strengthening the whole pelvic girdle. So here's another example. If somebody's had a total hip replacement, for the first 2 weeks, they're leaking urine, and they're like, I never did this before. It's because you're cutting into the same muscles that are inside that pelvic girdle. And so when you go from sit to stand with your new hip, you can't automatically activate those muscles. Your memory has forgotten that, but it will come back. So sometimes it's Kegels and sometimes it's just strengthening core, the surrounding tissues, just to give just some support, almost like a corset to the whole system.
And it's covered under insurance?
Yes, it is.
Thanks.
Yeah, 2 great points. Recovery or pain after a robotic surgery, we usually treat pain with Advil. And, you know, I don't want to speak for everybody, but that is the most common scenario. Yeah, estrogen, I believe that the normal transgression of pelvic floor weakness in women in particular usually involves some kind of injury at the beginning at some point in their lives, typically being pregnant. After 20 weeks, we know that the pelvis changes. Having a delivery is usually the most common injury down there. But you typically have the benefits of the estrogen hormone flowing around, and you get a lot of compensation. As she well pointed it out, when you go through menopause and that estrogen starts becoming deficient, and those tissues that are already injured, you know, this is when the symptoms come. This is when you have to deal with prolapse, unfortunately, or incontinence more commonly. And so supplementing is key.
I like the way you discussed everything because there's a lot of people who get a prolapse and they panic, and I would too. You've got an organ falling out your body. So they go to the ER and they can't do anything for you.
Right.
But the fear is still there. So it's just such an awesome resource to have you in town.
I noticed you do fibroid removal. How do you go about doing that? Is that done robotically or?
Yeah, whatever we can do minimally invasive, we will do minimally invasive. Okay, and the robot is a great tool for these types of surgeries. Depending on the size, the location, and whatnot, typically you were able to remove the fibroids from the uterus, kind of put them in a bag as we complete the surgery, and then at the end we find a way to remove them. In the older days, you used to have a power morcellator that would kind of basically break them up into small pieces, and you would take them out through the singular incision, 8mm, 10mm incision. Because of the fear of spreading an unknown tumor, we've had to change the way that we do it, and you can still do that, but contained within a bag. So there's a different bag in your belly that you can kind of break up the fibroids that way and remove them. We can make a mini laparotomy, so instead of having a 10mm incision, you'll have maybe a 4cm incision, and we can oftentimes pull fibroids that way. So there's still there's different ways to do it, but minimally invasive is definitely the way to go, unless you can't. I mean, there's going to be certain scenarios where they're too big, and the risks of bleeding are kind of higher, and so you would know ahead of time typically, and you would plan it that way. But nowadays, we're kind of pushing the boundaries, and we're able to do a lot of the things minimally invasive.
Thanks. How does bladder Botox injections assist a patient?
This is a treatment for patients who have an overactive bladder. An overactive bladder means a bladder that tries to pee when it's not time to pee. Okay, and so initially the pathway is you have to try some medications first to try to prevent those bladder spasms or minimize them. And if they don't work, well or you have side effects from medications, then you become a candidate for Botox treatment. And basically what it is that you're bringing the medications directly to the bladder. You're injecting the Botox within the muscle of the bladder, and that forces the muscle to relax. It partially paralyzes the bladder. That in this scenario, that's a good thing. It makes your bladder more efficient. It forces the bladder to relax. When the bladder relaxes, you can hold more urine. But when it's time to pee, you'll be able to muster a good contraction and have more of the urine come out of that.
How long does that injection last?
Everybody's different, but typically between 7 and 9 months.
Okay.
Okay.
I have last week. He's my doctor.
Okay.
Any more questions?
Thank you so much.
Thank you.
Okay, I want to talk a little bit about some of the events that we have coming up and future meetings and so on and so forth. So, like today, we have, a few people out and we're at, some seminars, doing seminars and stuff, so we typically have a few more people in this, but, you're going to see a lot of information, like for instance, up at the table, like for instance, we have husband and wife team, the Whites, and they have a big event. They have one today that's they're all speaking today. Of course, they always talk about Treasure Coast Avenue for seniors. And then they have a big one, and there's some handouts in the back, April 4th, and it's going to be at Harbor Place. So it's going to be a pretty great event. They're going to talk about what they do. And of course, their mantra is, after 55, you can be longer, healthier, happier, sharper, so on and so forth. So we're all about, getting healthier. We also have a lot of other things that are happening. So on May 7th, we have a second annual resource fair that's in Fort Pierce. Tamara Barnett and Mark Green is supposed to be covering that. So we're covering it for their business, but they're going to be covering it for Treasure Coast Advocate Seniors also. September, we have Battalion Health Fair. November, we have an annual event that's typically at the Lexus of Treasure Coast, which we'd like to talk about. And I'm sure we'll have that underway soon. So with Andrea. So any other events that any of you have that you want to talk about that you have coming up? Any businesses? No? Okay. So you get a chance, people who can't be here, again, you can check this whole thing out on YouTube. It will get, once it gets set up, it will get recorded and put over to our site or Facebook site. We have a tremendous amount of information. So also Witham, everybody know what Witham is, right? What's in it for me? Right? So if you join, what do we do for you? Well, number one thing is helping our seniors in the Treasure Coast, so that family doing that first. Secondly is, recently we have about 100 different businesses that we are tagging through our Facebook sites. So like for instance, just yesterday I did 83 on one Facebook site, inviting them or talking about us, and so we have all that. Just like with the doctor, we'll have something out to all of those companies, thanking them for being here and great seminar and so on and so forth. So we have all those things going on out there. That didn't happen, say, a year or two ago. We've grown, we've evolved, and we're doing all those things now. And that's happening. So you'll have a tremendous amount of advertising plus our site, the information, so people can take and will take and see your name in all the things that we do. So very, very important. Anything else, Catherine?
You want me to talk about upcoming meetings?
Go ahead. Boy, and we have a few.
Yes, we are very blessed, very lucky to have so many great speakers coming up. So, in April, we've got our guardian ad litem, Vicki Stromak's going to be speaking. Radiant Recharge is our coffee sponsor. In May, Christine's going to talk to Palm City Rehab since it's rehab month, and maybe they can come and speak about stroke. And Legal Shield is our coffee sponsor. June, we've got Treasure Coast Hospice, and Marty is our coffee sponsor. July, we've got Dr. Emerson talking about nutrition from Coastal Oracle. August, we've got Medicaid and estate planning, and Christine, you're our coffee sponsor. And September, Treasure Coast Surgical Group. Don't have a topic yet, but they're gonna come. And our coffee sponsor is White Glove. And then in October, we've got the Council on Aging program, and we have a coffee sponsor, Katie Diamond. We're not here for November because of the holiday, and December we'll have a holiday party here, right here in this room. So we hope you can join us for the upcoming meetings. Thank you.
And how are we doing for 2026 so far?
Oh, well, I didn't want to go that far. Okay, we've got January, Bill White's gonna talk about his company, the Prime 55 and older. February, LifeWave, John Daly. March, Dr. Radke, I put him in Martha for March.
Oh, perfect, I feel like I'm not, like.
Yeah, unless we have a cancellation or unless I can jog some things around.
We opened a new breast center, just so you guys are aware, in Tradition, Longwood did. It's beautiful, you're welcome to stop by and check it out. Dr. Aurora is the name of our radiologist, she's phenomenal. If she's there, they do all the biopsies, everything on site there. And Dr. Radke, who spoke in the past, also does a lot, he's a breast surgeon who does a lot of that at Longwood as well. So it's a growing service that's very needed, and I thought it'd be helpful if they shared some of those updates. But if you're ever out in the Tradition area, I forget, it's where the surgery center is there by Publix, that two-story building.
Okay, and I have to give kudos to Dr. Radke. He just did abdominal hernia surgery on my Bob this week, and he's a phenomenal doctor. We had him come and speak, and that opened the doors for him to gain, more recognition in our community, as it will for Dr. Louise. And in April, we've got Dr. Josh Sabat coming back, so that's it. Thank you.
Unbelievable, right? So we're set up for well over a year with these. So we've got some great speakers. So again, thank you for showing up. Spread the word, right? Let everybody know who we are. Get the word out there. We want to try to help as many Treasure Coast seniors as we can. So if you know somebody out there that needs our help, we'd be glad to do it. So not forget, we are volunteers. We don't get paid for this, right? But we love doing it. So have a great day.
Great presentation. I learned a lot. Curious.